I thank Dr. Ratna for giving the foundation of energy sources, and we have clearly got an idea what basic energy sources, monopolar, bipolar, and some introduction about ultrasonic. I bring greetings from my hospital, which is Sargangaram Hospital, and this conference is being organized with the blessing of Dr. Subhash with our institute only. I welcome you all here. So you know that surgery is like an art and energy sources are our brushes. And we are now going to talk about upgrading from crayons to the lasers. The SAGES program for fundamental use of surgical energy sources was introduced in year 2010. And this, the motivation of the concept of fundamental use of surgical energy sources was the discussion on the oral presentation by our chief, Professor B.B. Agarwal. And he has been doing a lot of work on energy sources from at least 15 years, as I know, and he has published lot many articles on how to use the energy sources safely, which becomes the groundwork how we perform our surgeries in the theater. And you know that when the scalpel is not enough and the fire feels too risky, science brings us the energy devices. And these energy devices are essential in modern surgery for cutting, coagulation, sealing, and ablating. And traditional energy sources are reliable but can have unwanted side effects, as shown by Dr. Ratna in her slides. Innovations in the energy technology aims to minimize complications and maximize precision, making surgery safer and more effective. So from lightning sparks to the OR, it has been a very exciting journey for energy and it's the modification of the devices. In 1920, the introduction of monopolar was done by William Bowie, and then there were many advancements. And now we have integration of the AI and the robotic platforms with energy devices. But the limitations of the traditional devices are being taken up by these newer devices, which we will discuss soon. And these are, in my presentation, I will discuss about the ultrasonic energy, which is harmonic scalpel, advanced bipolar, CUSA, lasers, plasmas, radio frequency ablation, and microwave. You think of these tools as avengers of the surgery. Each is having a unique superpower, which we are going to discuss. So let's start with harmonic. The use of ultrasonic energy, as the introduction is being already done by Dr. Ratna, and this utilizes not the electric current, but this is utilizing high frequency blade which is moving at a very high speed. So what happens when we use this harmonic? I believe most of us has already used harmonic in the theaters. So the working principle is ultrasonic energy, cavitation effect, coagulation through protein denaturation, and low thermal spread. The harmonic scalpel becomes a standard instrument in minimally invasive and robotic surgery, and it is most widely used instrument while we are doing any of the advanced minimally invasive work. The newer versions incorporates advanced features such as adaptive tissue technology and real-time energy modulation. And it was exciting when I was making this presentation to know that it's already been about 30 years the harmonic was introduced, and many of us who are sitting here, it's beyond our surgical operating age that harmonic was already induced and we are born in the harmonic era. So there are many advancements over the years in these energy devices, particularly harmonic, the generator, the probes, and now we have HD 1100, which Dr. Ratna has already told us. Next come is the ligashore. Ligashore is the advanced bipolar. As told, it gives us a biofeed. It gives us a feedback how and when the current is to be stopped, and usually it gives a feedback in the form of some buzzers, and then we know that the tissue is already charged. The device applies a combination of pressure-controlled thermal energy and denature the collagen and elastin within the vessel walls and tissues. This process fuses the tissue to a level that even if 3 times the normal systolic pressure will happen, the sealing will not give way. So you can see on the right side of the image the ligashore being in action. The advantages are higher efficacy, reduced operating time, and safety, cost effectiveness in use of clips, because you omit many clips ligating these small vessels as seen in the video of sleeve gastrectomy. But the limitation is it cannot seal calcified or fibrotic vessels. The initial equipment cost is high, and this requires special training. There are various advancement in the probes of the ligashore also in terms of laparoscopic and open surgery, and the ligashore device also remains a revolutionary tool in energy in surgery, offering precision, safety and efficiency, making it an invaluable for both open and laparoscopic. But we should always learn that faster is not the way to look forward. It should be safe. So it is safe, but many of us are not using Thunderbeat now because we are more or less very accustomed with other energy sources like ligashore and harmonic. The other energy device apart from the ultrasonic and the bipolar going to talk about is CUSA. CUSA is Cavitron ultrasonic surgical aspirator, and it works on the principle that the device generates ultrasonic vibrations, typically to the tune of 23 to 36 kilohertz at the tip of the handpiece. These high frequency vibration causes tissue fragmentation by disruption of the cellular bond in softer tissues with higher water content. So, disruption of the tissue depends upon the water content of the tissue, which is widely seen in the parenchyma of the liver and other tissues, and it does not act on the firmer tissues like blood vessels or fibrous tissue, which remain intact even if you apply the tip of the CUSA over the blood vessels. You can see in this video the CUSA, laparoscopic CUSA being used for hepatectomy, and it is being utilized over the vessel, but the vessel is not damaging. So this is a newer CUSA where you can select the depth of tissue hardness, and then you can activate the tissue CUSA according to the tissue hardness. There is a wide application of the CUSA in neurosurgery, hepatic surgery, pancreatic surgery, even in gynecological and pediatric surgery. The limitation is the slow tissue removal. It is expensive and ineffective on hard and calcified tissue. Lasers also is an advanced energy source. We have already using laser in many of the surgeries like anorectal surgeries or fistula surgeries, also venous surgeries. The mechanism is selective absorption of the laser light, which gets converted into heat, and this leads to the absorbed light energy is converted into heat, causing controlled coagulation, vaporization or cutting. There is minimal collateral damage, and the precision of the laser energy minimizes damage to the surrounding tissue. So applications are varied. In general surgery, as I have already told you, we are using it in proctology for hemorrhoids, fistula, pilonidal surgery, tissue ablations, hemostasis, oncology. In dermatology also they are being used. In vascular surgery for endovenous laser therapy. In the video you can see the laser being used for hemorrhoids, and in this video you can see it is being used as a demonstration for varicose veins. The types of laser which are available in the market are CO2 laser, which are mainly used in general surgery and dermatology, ND-YAG, diode and ER-YAG lasers. The future directions of these laser incorporations are into the robotic integration, combining lasers with the robotic surgery for enhanced precision, advanced wavelengths and minimal invasive techniques, expanding indications in OPD and office-based procedures. The laser technology continues to be revolutionized in surgical fields by enhancing precision and reducing complication and improving patient outcome. This too comes with an initial equipment cost, but there are many companies which are being producing lasers and they are widely available here in India now. The next very fascinating is argon beam coagulation. These are plasma based coagulation, and these are non-contact. This is the only thing which is basically non-contact electrosurgical technique that we use. On the right side you can see it is being used on hepatectomy, charring the superficial tissue and causing surface hemostasis. Why surface? Because they have a limitation that they cannot go into depth. So what happens is there is an ionized gas conduction, argon gas, which is released from the probe, and electric current creates a plasma that directs energy to the tissue in a focused manner. The non-contact application occurs without the coagulation occurs without direct contact of the electrode, reducing the risk of tissue sticking or injury. There is a wide area of coverage for this argon beam coagulation right now, and we are using it in a lot of surgeries. Uh, this can be used. I was talking to urologists in hepatectomies, in partial nephrectomies, and any place where you require surface coagulation. The advantages are reduced blood loss, non-contact method, and uniform coagulation, which minimizes the risk of ionized overheating. But the limitation are the cost of equipment. Special equipment is required for both open and laparoscopic, and organ supply is an issue. So it is ineffective in deeper tissue, as already told, or vascular structures requiring sutures or clips. Next is the RFA and microwave. These are two last advanced energy sources I'm going to talk of. RFA is minimal invasive surgical technique that utilizes high frequency alternate current to the tune of 350 to 500 kilohertz to generate heat and destroy pathological tissue. RFA is delivered with the help of an electrode, and here you can see a liver lesion which is amenable to RFA. An umbrella kind of structure comes out. It's a mesh of wire which causes the generation of the current around the tumor and causes the coagulative necrosis or necrosis of the tumor. This can be used at multiple points. The advantage is it can be used as an OPD basis. We recently have a successful ablation of at least 4 liver tumors in a patient of colorectal malignancy, where we did a right hemicolectomy, and under the same sitting, under the same anesthesia, RFA was done into the operation theater, and she is right now receiving chemotherapy. It's been about 4 months after the surgery, and there is no sight of any other metastasis. Last is the microwave. The microwave uses electromagnetic waves in the microwave spectrum to oscillate water molecules in the tissue. The molecular agitation generates heat, leading to their thermal coagulation and cell death. Heat produced by the microwave energy raises the tissue temperature to about 60 to 150, causing irreversible damage to the proteins, lipids, and cell membranes. The coagulative necrosis ensures that the tumors or pathological tissues are destroyed while minimizing damage to the adjacent tissue. There is advantage of the microwave energy in the sense that it is effective even in tissues with low electrical conductivity, such as charred or desiccated tissue, and there is faster ablation due to higher energy output. It is applied in oncology with liver tumors, lung tumors, kidney tumors, in gastroenterology for ablation of the unresectable tumors like pancreatic tumors, thyroid nodules, in pain management, and in cardiology. It is emerging as an use in atrial fibrillation, ablating for creating precise lesion in the cardiac tissue. So you all know that these all high-tech tools are like luxury cars. They are fantastic to have in, but they come up with a hefty price tag and require careful handling. So even if you have a lot many cars in the garage, you are mostly accustomed to one or two of them. You should confine your practice to one or two which you are used to and which you can drive safely. And the end point of interest is patient safety, which is the only thing which matters in the OR. And knowing your tools is the half the battle. The other half is not letting them burn you. So the future is bright, and luckily it is not just from the sparks of our device. We have now AI integrations which are already being in the process of incorporating in your OR. Miniature energy devices are being introduced for natural orifice and endoscopic surgery. They are bioelectrical energy for enhanced wound healing and nanotechnology to target and destroy cancerous tissue. And in the hands of the skilled surgeon, these devices turn challenges into success stories. And I thank you for being a patient listener, and thank organizer for giving me an opportunity. Any questions and comment are welcome. Thank you.